We often don't give therapists enough credit. I always say 50% is what I do and the other 50% is what you and your therapist do. In a setting of a complete transverse median nerve laceration where I'm going in and fixing it, maybe wrapping it, repairing it, I can use that wrap, take a suture proximal to and distal to it and sort of offload that tension, allowing them to extend their wrist, which allows me to move them earlier. Same thing in the elbow, same thing in the knee. These college athletes, they get a multi-leg injury and they tear their common peroneal nerve. And it's intact, but maybe it's stretched out and it looks sort of ischemic. Is that a situation where you just want to sort of put that to bed and rest easy? I mean, no, because you know that as a high-level athlete, that patient needs to get moving, otherwise you're going to get stiff. Their whole career, their whole livelihood depends on that. That's a situation where I want to protect that nerve, let it rest easy, let it recover, but you've got to get that patient moving with their therapist so they don't get stiff.